Hello, and thank you for joining us. I'm Sandy Potter, and with me once again are Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. Amongst the many things that we are feeling grateful for this holiday week is the encouraging news that has been coming out about the work being done on a vaccine for COVID-19. Dr. Schwartz, what are you hearing about the trials, and just how close do you think we are to having an effective vaccine?
Well, actually, that's an excellent question. And this being day before Thanksgiving, we do have certain things to be thankful for, even though we're still way into the pandemic and unfortunately cases keep rising on a daily basis. But there are three main vaccines that are right on the cusp of being approved by the FDA. And I thought I'd talk to you a little about them today and kind of give you some ideas of how close we really are to making a lot of progress. So, you may have heard of some of these different vaccines just by watching the news. But the first one I'm going to talk about is a Pfizer vaccine. And the Pfizer vaccine is actually being looked at by the FDA December 10th for hopeful approval. So what does that mean? It means that maybe in the next couple of weeks, after the middle of December or so, we might actually be able to start some process of administering vaccines. And it doesn't mean at all that suddenly on December 15th or whenever that everybody's going to have this vaccine and everybody's going to get the vaccine and so forth. What it means is that things are in motion, things are moving forward. There's another vaccine called Moderna, or made by Moderna, that's actually being looked at by the FDA December 17th. So you see that there's a lot in the next few weeks that are very exciting news. So what I might do for just a minute or so is just kind of talk about these two vaccines, the Pfizer vaccine and the Moderna vaccine. And they're both what we call mRNA vaccines. And just basically the COVID-19 virus is an RNA virus. And so mRNA, it attacks the RNA in the virus. That's basically how these vaccines work. But as part of this process, they need to be stored for transport at very, very frigid temperatures, like minus 90 degrees Fahrenheit, which is very cold. But they have been shown to be very efficacious. And in clinical trials, 95% efficacy has been shown, which is remarkable. And, I'm a big proponent of the flu shot, and I've taken it ever since I've been in my medical career. And the flu shot generally has an average efficacy of about 45 or 50%. So this is significant news. And I think the main thing to realize is that no matter what vaccine you take or what you get, there are always risks of side effects. And side effects come with any kind of vaccine. The main side effects they've seen in clinical trials here are fatigue that can be persistent. You can get soreness at the site of the injection, redness. You can get muscle aches, we call myalgias, fevers, chills. But again, these are generally short-lived, and it's expected that you might get certain symptoms from getting a vaccine because it's a sign that the immune system is working. And these vaccines generally are administered twice, like in 2 different intervals to kind of help boost the immune system. And the final vaccine that I'm going to talk about is made by Astrazeneca in Oxford. And this is a slightly different, this is a different kind of vaccine. It's not an mRNA-based vaccine, but it's a viral vector vaccine. So what does that mean? It's actually interesting. It comes from an attenuated viral strain that causes the common cold in chimpanzees. But this is actually going into phase 3 trials, and it looks like by the end of December, again, the FDA will review the data, and hopefully there may be 3 vaccines that might be approved. So this is very encouraging news. The Astrazeneca vaccine has been shown to show a robust immune response to older people, and it's like 70% effective, which is very significant. The other thing to note about it is it's actually lower in production costs than some of the other vaccines, and it doesn't need the same very frigid temperature to be transported, but it can be transported almost like in a refrigerator type of temperature. But I think the bottom line to know is that whatever happens as things move along, healthcare providers, healthcare workers, particularly those of us that work in nursing home facilities, will be sort of in the front line and given priority to get these vaccines, because again, to protect our frail elderly people, and we've seen, the devastating effects that this virus can have. So this is all very encouraging news. And I guess for me, just to conclude on this pre-Thanksgiving Day message, I just give this one little inspirational quote, which is, "Don't worry about the world coming to an end today. It's already tomorrow in Australia." So thank you for that.
Wow, thank you, Dr. Schwartz. You never fail to have the most perfect thing to say. That is really encouraging. And, JP, to continue on with what Dr. Schwartz was saying, what are you hearing about a possible timeline for when a vaccine might be available to our staff and our residents?
Dr. Schwartz did an absolutely fantastic job talking about the vaccines and really the effectiveness of it. And what we're hearing and what we've been having dialogue with the state of Connecticut is there is every expectation that there will be a distribution of the vaccine the middle to latter part of December for certain key at-risk individuals. And in this case, their first true attempt to get the vaccine out will be for the nursing home and the healthcare workers. We have submitted all of our numbers to the state of Connecticut, and we are anticipating a pretty large shipment of the vaccine for all of our nursing home staff and our residents. And, our expectation is over the next few months that we'll be able to get the vaccine really distributed throughout our entire system. But I will say that is all predicated on FDA approval and the distribution process that we are working with our vendors, if you will, from the state of Connecticut. So it's going to take us a little while to really have a true timeline. But our expectations are that we will be distributing or providing the vaccine the end of this year, which is absolutely fantastic news. But with that being said, I do want to caution everybody and let everybody know two things. The first is it's going to take a while for everybody to get the vaccine. That is the first thing. The second is this vaccine is not the magic potion that is going to cure everybody from getting the virus. So we don't want people to think that this is necessarily the cure and we're done. There still has to be precautions. Infectious control, in my opinion, will be something that will have to stay in the forefront of everything we do every day. So the vaccine will help, but we still need to do our due diligence to make sure we don't spread it at all. And I would like to thank all of our staff for doing an absolutely amazing job fighting during this. It is probably the most stressful time we have been through as an organization, as a state, as a country. But I can't tell you how proud I am of our staff, of everything they do. I received an email yesterday from a family member who couldn't say enough about the care that their loved one was receiving by our staff at the healthcare center. And it truly just warmed my heart. It made my day. It reaffirmed why we do what we do each and every day. And hearing that through an email, or reading that through an email was just truly amazing. And truthfully, hearing Dr. Schwartz and his passion in what he does truly tells you what we are all about as an organization. And the vaccine will be something that we will work diligently to get out to all those that we serve and all of our employees. So it's extremely important to us as an organization.
Absolutely. Wonderful words as we all stand together to continue to fight against this virus. And we do have so much to be grateful for, including our amazing staff and everything they're doing every day. Thank you both so much for sharing your time with us once again today and for all of this very important information. And thank you for watching at home. We hope you'll all have a safe and healthy and happy holiday weekend. Take care.
Stay Masonicare strong.